Hi everybody, thanks for watching. I greatly appreciate it, although I don't know if you're going to be watching this. This is going to be a bitch session. Yes, I have a very big complaint and nobody seems to want to help. So, you all know I had a reverse shoulder replacement complete, done in April of last year. By May 3rd, I was released pretty much. I mean, I still had stiffness and stuff. That was my first, post-op doctor's appointment. Well, when the second one hit in June, okay, we're gonna back up a minute. So, I had a very awesome surgeon. And I mean, he was fabulous, and his name is Dr. Woods. Just the most incredible bedside manner I have ever seen. He is out of St. Catharines, but he's affiliated with Community, which is now Powers Health. I sit on the board there. It's for patient advocacy, and I'm probably going to get in a whole lot of trouble for this. Powers Health is my hospital. I could never, ever in a million years go to another hospital for anything. But now we're having issues because of what happened. So I went in May 30th for the first post-op checkup. Everything went great. So my next one was in June, and I went in June, and everything was fine. The nurse walked in. Her name is Beatrice. Yeah, just call her B for what I'm about to tell you. So she walked in. She asked me what was going on, and I had pulled out one of the dissolving stitches because my body is the type of body that does not dissolve them. Trust me, because I just had a molar pulled. And when they put the stitches in, they said they would dissolve. They didn't. I had to pull them out because it got infected. So yeah, now I'm on antibiotics. That's another story. But anyway, I'm sitting in the room. She comes in. She asks me what's going on, how I feel. You know, in the beginning, she was real nice. And I told her about the stitch not dissolving. And I had it in my purse, mind you. I had it. And because I saved it, I needed him to see what had happened. So she goes out and she goes to the PA, which I absolutely adore this PA. He should have been an orthopedic surgeon from the get-go. He was just so friendly. Now, this was my first visit with this man, so I hadn't even met him yet. So she goes out and she goes and talks to him, and I can hear her telling him about me. And she goes, yeah, and that effing idiot said that she had to pull the stitch out. And she goes, I know those stitches are black. Well, no, they're not. Dissolving stitches are always white. And I heard him tell her that, and you know, all she said was, she's an effing idiot. And I heard this. Now, mind you, I'm in the furthest room away. So that means everybody in these other rooms heard her call me that. Okay? So when he came in, he asked me how I was doing. Well, needless to say, I was fuming, but I just told him I was doing great up until about 5 minutes ago when I heard her call me an effing idiot. And he goes, you heard that? And I said, yes, I did. And I put the stitch on the table. I said, there it is. Now you tell me what stitch that is. He couldn't apologize enough for her behavior. Honest to God, he was just so nice about it. Well, he looked at my incision and stuff, and he said, yeah, you still got a few in there. We're going to get those out. And I'm like, great, because it's been a month and a half with these things, and they're not dissolving. I said, they got my shoulder sore. So he cleaned it up real good. He said, normally she would come in and do it, but he's not going to let her back in the room with me. This guy was fabulous. He was all heart. I mean, just fabulous. I loved him. So I left and he said, I want to see you one more time. So I'm looking at him. He goes, don't worry, she won't be here. So he made my appointment for July 7th. Now, mind you, I filed a complaint with St. Catherine's Hospital and their patient advocacy. And I told her exactly what happened and everything. And she says, well, I'm going to look into this. And I'm thinking, okay, because I was bound and determined to take this woman's job. Bound and determined. Because who in their right minds would let somebody work in their office that treated your patients like that? So I got a phone call from Dr. Woods' office in, I think it was either St. John or Munster, and telling me what would make me happy. And I told him I wanted her job. And the lady said, well, by rights, I would too. So anyway, I get another phone call from this other patient, the manager of another office of his. And she goes, when you come in July, she said, we will make sure she verbally apologizes to you. And I'm thinking, you know what? As long as it's from the heart, I'm not going to pursue this. But if she doesn't do it from the heart and it's just because you people make her do this, I'm still going to continue this. So little did I know when I went in July 7th, they sent her to lunch. So she wasn't nowhere to be found when I got there. The frickin' secretary came out and did my intake. And I asked where she was, that I was supposed to get an apology. And she says, oh, she's at lunch. I said, get me the office manager. Office manager came in. Now, this is the doozy one, okay? This is just doozy. I said, where is she? And she goes, well, we sent her to lunch. We didn't want her in the office while you were here. And I said, excuse me? She was supposed to apologize to me. Well, because I'm the office manager here, I gave her the option if she wanted to apologize to you. How do you give somebody an option to apologize to the patient that comes here? I'm on Medicaid. I get that. But you know what? You're still getting paid for me to be here. And I tore into this manager like no other. And then she broke HIPAA. Okay? Literally broke HIPAA. She told me that this is not the first time she has done this. She's been written up before for doing it. And she's still employed there. So then I keep pursuing this thing. I took it to the board meeting at Community Hospital. Now, I love this board. The Patient Advocacy Council is just freaking awesome. We do a lot of good. I do it for people in wheelchairs. All right. I strongly believe that people in wheelchairs deserve the same courtesy as people that can walk. Now, granted, I may be weird about this, but I drive, okay? And I'm tired of doctors giving freaking people overweight a handicap placard. Those are the people that need to walk. You're not doing their health any good by giving them a handicap placard. What business is it of you because you don't want to listen to them? You know, this way you'll keep them quiet. You know, that's wrong. That's wrong. Where does your job come in at then? If you're just catering to them. You know, I'm at a loss for words. How people are so stupid. You know, they gave my sister-in-law one because she gets headaches. Yeah. You don't think I tore her a new asshole? Excuse me. Sorry about the language, but that's the truth. You know, you're taking it away from people in wheelchairs that want to be independent. I drive. I do my own grocery shopping. How do you think I feel when I get to a grocery store and you see women walking out because they're overweight? And then you have to park at the other end of the parking lot so you can get in and out of your car. It has to be a specific parking spot so you can open your door and build your chair. How wrong is this? Seriously. But anyway, this board is incredible. I've been to the hospital so many times and I've had to park at the end of door B. Excuse me, I'm sorry. I just had breakfast. I've been in door B and have to ride my wheelchair all the way to door A because they only had like 6 parking spots. You don't think everybody's going to grab those if they get the opportunity? And I've seen young people do it, get out of the car and walk normal. Why do they have a handicap placard? It's probably their mothers or their grandmothers, and they're using it to get front parking. How wrong is this stuff? So the board actually put in more handicap parking spots. Still doesn't help me any because the board meetings are like around noon, and when I get there, of course, they're all full. But it helps other people. So anyway, this board is wonderful. So I took it to the board meeting. Yeah. And the CEO, the CFO, the chief surgeon, and all that was there. And when I told them what happened, they all got on their phones. That's how mad they were. You know, and I give those men a lot of credit. Lot of credit. Randy, the CEO of Community Hospital or Powers Health. Awesome man. Oh my gosh. I mean, he is just down to earth. He is a people person. He talks to you like you matter. And that's all anybody wants to feel, is that they matter. So anyway, I got a text back from them and they called Dr. Woods. And little did anybody know that Dr. Woods' office is a company. It is a company. They have rules they have to follow about firing people. And yeah, it's a 3-strike rule, and I was number 2. Trust me, I know that because the lady, the manager of the East Chicago office, broke HIPAA. She broke HIPAA and told me this girl's story. Okay? Who does that? So then, of course, I went into my mammogram and I got all these phone calls from people discussing this, and I was up to here with everything when I found out I had cancer. So I put it on the back burner. And then they transferred my medical over. I'm still on Medicaid, but I'm with Pathways for the Aging. This is a stupid program. It doesn't benefit, and it doesn't make us anything easy. All these commercials tell you that they're trying to make people with disabilities or seniors make their life easy. In no way, shape, or form does this make life easy. No way. Okay? Every time something goes wrong, it's my job to fix it. Where those people just sit there and then they question your life. They don't know me. They don't know what I'm going through. But yet they're passing decisions on my life. Okay? They took away my aid. Okay? Well, I shouldn't say they took them away. They pretty much cut their hours. I'm in a wheelchair. Okay? I have urinary incontinence, so I wear Depends and pads. Do you know they cut that down too? Now I'm forking out some of my disability to buy incontinence products because Pathways to the Aging put a lower limit on it. Okay? How wrong is that? You know, there's so many things wrong with this program. And then they throw people in that don't know squat about disability. You know, and it's beyond me how the state of Indiana is going to pass judgment on my life and they don't live it. So, anyway, back. I've got so many gripes. So many gripes. But I wanted to get this out to you because a lot of stuff is coming up. And I'm getting in touch with Medicaid because Medicaid was my provider before. The most important thing, I called the medical board on this Beatrice. Yes, I called the medical board. And do you know she's not a licensed medical anything? Anything. So the medical board can't do nothing. So here I am. Yes. Here I am. Now I have to go through Medicaid to try to do something with this Beatrice. And I only have a few more months to get it done. I, in no way, shape, or form, did this to harm Dr. Woods, his office. I just want to let people know that this happens. You know, we're not people when we go into a doctor's office. We're a dollar sign. That's all we are. Big fat dollar sign. When they see you walk in that door, they look at dollar signs. And I'm over it. I'm over it. Now my left arm's acting up and I don't have an orthopedic surgeon because I refuse to see Dr. Woods. Refuse. Okay, now I have a long list of orthopedic surgeons and most of them work out of his frickin' office. So again, it's very limited for me. I don't know what to do because of this Pathways for the Aging, because a lot of offices don't take it. So I don't know what I'm going to do. I'm sorry. And if it keeps getting worse, I'm screwed. I'm screwed. Being in a wheelchair, this is something people, you know, they live with. You know, if you want to be independent and push your own chair, you're going to pay the price in the long run because it's repetitive work on your shoulder. So, anyway. So now I got to get in touch with Medicaid, and I'm going to file a complaint with Medicaid because this should never have happened. Never. Never should anybody be talked to or treated like that. Never. I'm a person. I'm a person that cares about other people. And they treated me like I was a dollar sign. They didn't care how this woman talked to me as long as they got their frickin' dollar. And I'm kind of over it. So I'll let you know what happens down the road. I will do that. But always remember, you matter. You do. You matter. You should never be talked down to, called bad names. Oh my God, you should never be called bad names. You should be proud of who you are and not feel small. Don't ever let anybody make you feel small. You matter. So that's all for today. I just wanted to get that out because I've been thinking about it for the last couple of days. My arm hurts. This weather's bad on it. So, but I just wanted to let everybody know that I'm a fighter. I'm a B word. When it means something to me and when you disrespect me, I become somebody you don't want to know. So, Beatrice, if you're watching this, I'm going to have your job. You take care for now. Thanks for watching. See you next time. Bye.